Hello, everybody, and welcome to another episode of Little More Closer. Today, we are going to talk about psychedelic therapy, and we have with us Yasmeen and Aarti. Today's intention is to sit with the idea around psychedelic therapy, explore it a little bit, and also get to know TheraPsil, the company that Yasmeen works at. So I'm Nida. I'm a therapist at Pause and also the social media lead. This has been my interest for a very long time, which is why I wanted to do this and sort of remove the stigma around psychedelics in a way. So I would like you all to introduce yourselves, start with our identity, locations, and also the work that we do.
Sure. Thank you so much for having me. My name's Yasmeen Sadain. My pronouns are she, her, and I'm calling in from Vancouver, BC in Canada today. I am the Director of Training and Operations at TheraPsil, and TheraPsil's a small nonprofit advocating for legal access to psilocybin-assisted psychotherapy for Canadians in medical need.
Awesome. Thank you, Yasmeen.
My name is Aarti. I'm the founder and psychotherapist at Pause for Perspective. And Pause is a space that works with mental health, and we're a team of about 20 mental health practitioners who work with the intersectionalities of social justice and mental health practice in the city of Hyderabad, but also offer services for people outside of India and outside of India as well. Yeah.
Thank you, Aarti. Thank you both of you for doing this. So as the name suggests, psychedelic therapy, we know that it has something to do with psychedelics, right? It means that this is going to be a talk about psychedelic facilitated therapy. And the common knowledge that we have is that psychedelics can be used for a transformative experience of a pain management. But is there more to that, Yasmeen? Like, can you tell us more about what is psychedelic therapy and how do you view it?
So we are working at TheraPsil specifically with psilocybin-assisted psychotherapy. So it's psilocybin paired with psychotherapy. So what we're seeing is that we're mainly supporting patients with treatment-resistant depression, end-of-life anxiety, and anxiety as a whole. And psychedelics, psilocybin paired with psychotherapy is allowing for patients to hopefully come to some sort of resolution or have some sort of deeper healing when they ingest psychedelics.
Right. And psilocybin is the only psychedelic that you're working with currently, or are there other also that you sort of use?
Yeah, so TheraPsil is only working with psilocybin, and the patient generally will have 3 preparation sessions, a dosing session that lasts about 4 to 6 hours, and then a minimum of 6 integration sessions.
Can you throw some light on what that looks like? If you could share anything that's okay sharing, like a case study or an experience that you've had.
Personally?
Yeah, personally or otherwise, like in a client situation.
So the clients that we're working with are end-of-life patients, folks suffering from treatment-resistant depression or anxiety. We supported the first patients in Canada to access legal psilocybin-assisted psychotherapy back in August of 2020. And most of the patients that we were supporting to begin with were end-of-life palliative cancer patients. And many of them were able to see their cancer as separate from them after having the psilocybin experience, where traditional talk therapy that they had been using wasn't going deep enough. So this allowed some of the patients that we've supported to have true healing.
Right. I want to know a little bit more about treatment-resistant depression. I'm wondering, Aarti, do you have any sort of insights into that, or what could you say about that?
I was actually curious just from Yasmeen, what it sounds like you were saying treatment-resistant depression for people who are experiencing and in the end-of-life care with cancer primarily, or is it just for all folks who might be, anybody who might be experiencing depression in that sense that is treatment-resistant?
Yeah, so treatment-resistant depression isn't necessarily paired to folks who have cancer.
So you've worked with people who not just have cancer, but just also treatment-resistant depression, it sounds like. Okay.
Yeah, so for traditional treatment options aren't working for them.
That's right.
When you say deeper and true healing, what does psychedelic offer in that sense? Like if you were to just give us a little bit of example around that, maybe?
Yeah, so for several folks that we've been working with, traditional talk therapy, traditional coaching, traditional medication, it's not allowing them to go deep into where perhaps their trauma actually sits, and therefore they're not able to fully heal. Lots of traditional medications in Western society are actually suppressing rather than going to the root of the problem, uncovering it, and then making sense of it, which psychedelics have the power to do. So to go for true healing, we believe that for some folks, not everyone by all means, but for some folks, psychedelics are an option to go to the root of their trauma, their anxiety, their depression, and make some sense of it from their psychedelic experience.
Right.
And then put the tools in to heal.
And in that sense, I'm wondering, you said that to go to the root of or to recognize whether trauma exists and then sort of find a resolution around it, right? I'm wondering, what stance do we take on trauma and its relation with the body?
Yeah, I think that would be a great question for RT.
I think it was directed, but I can speak about it. So I work with, so in India, I don't know if you have this context, but in India, we don't, psychedelics are still not legal and you cannot use them. And obviously we don't have training in using psychedelics in therapy either. There are, at least up to my knowledge, we don't have any training, at least in India, around that. So we're sort of in sort of no man's land here where we don't understand what that means, but we've had people that we speak with, people that we consult with that microdose, that work with, that use on themselves. And we've known that it's important to step away from stigma around drug use in order to be able to hold space for people that we see, and to be able to support them in what ways that, what ways that they'd like, and center their agency in order to continue to work with them in ways that work for all of us in the space. So in that context, of course, like I work with both narrative practices as well as mindfulness-based practices to center and understand trauma and how body shows up with trauma. And I think essentially, I believe that the way that I think of working with the body and trauma is that the experiences that the body has in any situation is really the body's way of responding to what is happening in the environment. And so if we center that the body's responses are responses to an environment, and typically an environment that's not supporting who they are as people, then how do we work towards honoring what the body needs? So that's the way in which sort of I look at trauma centered body-based work as well. And it's been important to the way that we see people or we consult with people in our sort of experiences of the work. Like I said before, I think folks who come in and there is so much know-how on what what drugs do for them. And there's a lot of lived experience on using it in ways that work for them. And to center stories of what the body, what they're holding in their body in terms of trauma. I feel like that work seems parallel in what I do in my practice. So in that sense, it's really at least work at Pause is centering people's lived experiences and honoring how agency is showing up and sort of supporting people and, co-traveling with them on that journey. So over to you. I don't know what your experience is, or if you could speak to a little bit about trauma, body, and psychedelics, and how you're centering that work and what that looks like in psychotherapy itself.
Yeah. So I'm not a clinician per se, but lots of trauma patients are seeking psychedelics. Right now, we're working primarily with treatment-resistant depression, anxiety, and end-of-life patients. So we haven't quite begun working with clients with PTSD at this point. That being said, trauma is held in your body, and psychedelics could be a potential route to release that trauma through tremors, through purging, through, seeing your trauma face on and then integrating that experience. But currently, we're not working specifically with PTSD patients.
Since it's such a treatment-resistant depression or depression that seems to not, like other sort of modalities don't have an effect on it, right? And psychedelics help in accessing some sort of deeper healing. And with anxiety, and also you said end-of-life cancer patients, right? What do you see as the crux of the suffering here, or the pain that you see in patients? Like, is there any insight that you can give around that?
I think it differs from patient to patient in their own experience. I don't think there's, a one size fits all model, and everyone's lived experience is so different. So it's really for what they've experienced in their life. And perhaps it's, not only the end of life distress, but it's other experiences that they've had in their life. So it is different from patient to patient.
And what about safety measures while using psychedelic therapy? Like, there's a lot of fear around using psychedelics, at least in the Indian context, about either going through a psychotic episode or something like that after using psychedelics, right? But that's more recreational. That has happened here. But I wonder, how is it different in a controlled environment and in a therapeutic process? And what safety measures are used there?
Absolutely. So there's many safety measures that are really important. When psychedelics are ingested, there's so much at stake. And so first and foremost, we think the practitioners who are facilitating the experience require proper training so they can support this patient in an altered state of consciousness. Two, it's crucial to follow a clinical protocol. And our method, our clinical protocol requires that there's 2 practitioners for every patient to ensure safety for both the patient and practitioners. And also the integration is crucial. So once again, following a clinical protocol, ingesting psychedelics isn't actually only about the actual dosing experience. It's just as much about the preparation for the experience to ensure that there's been medical oversight and assessment, that they have created a therapeutic relationship with their therapist, and that they're feeling that trusting relationship going into the dosing session. In addition to that, integration is likely more important than the actual dosing session itself. So ensuring that there's the tools in place for the patient or client once they've finished the experience, so they can integrate and make sense of their experience after their session.
Yeah, it sounds like, at least to me, 2 things that are standing out. One is that the relationship with the therapist itself and building that trust and safety within the therapeutic relationship. And then more than the dosing, the integration of the experience is what matters. And to make sense of what has happened while they were having that experience with psychedelics.
Absolutely. Yeah. And knowing that psychedelics aren't for everyone. So ensuring that there's proper medical assessment prior to the session is very crucial.
How do you, what sort of criteria is there? Like when you say medical evaluation or clinical evaluation, what do we need to be cautious about?
So I'm not a clinician, so I would defer to our doctors on that question.
Do we want to share any personal stories with psychedelics? Yasmeen, I mean, if you are okay with sharing anything that will throw light on what an experience with psychedelic looks like with safety. If you would like to share a personal story, that would be great.
Yeah, absolutely. So I've had several psychedelic experiences that have been very powerful and healing. In one experience, I had prepared for it for several months and knew it was going to be a very powerful experience. And in the experience, I actually met my dad in heaven and had a lot of healing from talking to him and realizing from 13 years before that everything was okay and that he was safe and he's happy. And that was a really powerful experience for me, and integrating it I'm still integrating the experience, and it's been years. So that was very powerful.
Yeah. I think psychedelics are really powerful in grief therapy.
Absolutely.
They offer this, I think they allow us to break away from rigid structures of our understanding of the world or otherwise, right? And we can have these alternate realities and alternate experiences that speak to our psyche, that sort of allow us that deepening of our understanding and how we make sense of grief itself, how we make sense of loss, and how do we reconnect with what we have lost, but also what we have gained, I think, in a process of that. Thank you for sharing that.
Of course.
Yeah. Aarti, do you have any experiences, or do you want to share something around this?
I actually don't have any experience with psychedelics. Yeah, there you go. But I know that, like, thank you for sharing, Yasmeen. And I know that I've had people who speak to me about really being moved by some of the experiences that they have had. And I've known that the container that is needed in order to be able to hold space and safety is really important. I'm curious, Nida, do you want to share too? Like if there were.
I have not had experiences with psychedelics, but I've had certain experience with marijuana, which is not as good as psilocybin, perhaps. I don't know what word to use. But what it made me realize is that it helps me get in touch with my body. It helps me connect with my body, and the trauma that is stored, like Yasmeen also mentioned, it comes out as tremors or anything, like the body moves, right? Like the body asks you to move that trauma out of the body, right? That's been my experience. And I think a lot of suppressed rage is what I experienced while having, like, I thought I'm never an angry person, I never get angry. And that broke, like that, I think the ego shield, that broke for me. And that's when I realized, there's a lot of rage that I store in my body. And that has been my experience just with marijuana. So I don't know what more can psychedelics offer in that sense with the body and trauma. And other experiences, right? Yeah, I think psychedelics really, if there is safety around, right? It also depends on the kind of environment you're in, the kind of trust you have with the people you're doing it with, or just like the relation that you speak of therapeutically, right? And if you're allowed to be yourself, if your body is allowed to have the experience that it wants to have, then perhaps it's a very transformative experience. Which also makes me think of, Yasmeen, you're working with legalizing psychedelics in Canada, right? Then what are um, some of the challenges with that? And also then, how do we look at misuse of drugs or use of drugs for self-medication, like a lot of youth, at least in India, who are unaware of the pain and suffering, right? They tend to gravitate towards psychedelics as an easy way of um, soothing themselves, right? Like it comes very easily for them, other than the legal part. But how do we then make sure that it's not harmful to the youth, but rather helpful and transformative for them?
Absolutely. So currently in Canada, we've got a charter challenge going for medical regulations. So I think that's a great first step of creating a doctor as a gatekeeper model to really ensure that the proper clients are using, not proper, but they've gone through medical assessment. They've had that conversation with their doctor and treatment team to ensure that psychedelics are a good route for them. Psychedelics aren't addictive. So in terms of, use, that's almost impossible. But to ensure that there's a proper clinical protocol and that we're not, having this experience and then not having the community to integrate with. So right now in Canada, there are legal ways to access psychedelics, but it's very limited. And that's why we're pushing for medical regulations and have this charter challenge happening. Yeah. And so currently, back in 2020, Section 56 exemptions, where a patient would apply to Health Canada to request access to psilocybin through the Section 56 exemption process. And if Health Canada approved their exemption, they had legal access for 1 year to possess, consume, and transport psilocybin for their psychotherapy. As of January 5th, 2021, or 2022, so just over a year ago, Canada amended the Special Access Program, which then designated a doctor, nurse practitioner, the rights to apply for special access for their patients to use psilocybin in the course of their treatment alongside a treatment team. And so that's the legal access route currently. It is amazing. The only thing is it's very limited. So only 72 patients over the last year have gained access to psilocybin. And so many people are continuing to suffer or dying without access to their medicine. And so that's why our charter challenge is so important. We want to ensure that access is open for folks who are suffering and who need it. And I think a first step is medical regulations, and then we can see how that goes and then see if it can open further based on how the medical model goes. Based on what's happened with cannabis, I'm sure we'll follow similar suit.
Right. Yeah. And I think cannabis is used in Parkinson's disease a lot nowadays and in pain management. At least what I've heard of in US. And psilocybin is still not that widely used. I'm also wondering, are there cultural and religious challenges, that show up while using psychedelics? Some people might have this idea that some cultures, tradition, like Asian cultures, did use it, right? Like we have certain history around psychedelics, but certain cultures and religions don't allow for that, right? And is that also a challenge to, I don't know, like to make use possible?
I'm sure it is. what I'm more concerned about is that Indigenous people have been using these medicines for tens of thousands of years, and they are the true knowledge keepers of these medicines. So it's really important that we are, not westernizing these medicines too much, because these are sacred substances, and we need to consult and learn from the Indigenous people who have been using these medicines for so long. So it's a really tricky, it's very tricky to ensure that, this medical model is working in conjunction to and making sure that these medicines, we're not taking away from any traditions.
Right. Yeah. When you say we don't want to westernize it, what do you mean?
So right now in the Charter Challenge, it is a medical model, but Indigenous people have been using these medicines in ceremony for so long. So it's really important that if these do become legalized, that we work together to ensure that we can learn from them, who are the true knowledge keepers.
I'm thinking of how do we, have you had clients who have had a psychedelic experience before, or as we say, a bad trip, and then they've come and wanted to integrate that experience? Or you're not a clinician and you've mentioned that, but I'm wondering, do you, Aarti, and you can answer this as well, I think, with just psychotherapy. How do we move away from the shame and guilt associated with that, with use of psychedelics? I think.
I think first and foremost, there's no such thing as a bad trip. A bad trip, perhaps there wasn't preparation, and perhaps there isn't the proper set or setting. But I think in ensuring in every bad trip, there is some learning. So we try to move away from that language and move towards a challenging trip. And hopefully from that challenging trip, there is learning. But I think to reduce the stigma, it's really important that you have the proper team in place. You've got the preparation. You prepare for the experience. You ensure that on the day of your journey that you're in the proper mindset and you're in the proper environment, referring to set and setting, and that you've got a community in place to integrate your experience. I think if you have that structure in place, there's still, of course, an opportunity to have a challenging trip, but at least you're in the proper container. So creating that safe container is crucial. And, people seek out psychedelics for healing. So yes, something challenging might come up, but to ensure you've got that integration after to make sense of perhaps a challenging experience is what's really important.
I like how you've used language around it, like how you said, move away from calling it a bad trip and a challenging trip, and challenging things might show up, right? Of course they will. And also about how it's a journey rather than just an experience or something you've tried out, right? It's a journey that you take into yourself while you're on the psychedelics, and you need a community and a safety container to integrate it. I think that's a good perspective on it. Aarti, do you want to say something to that?
No, I think I agree with what Yasmeen said about just being able to hold space for people who experience whatever they do, and making sense and integrating it into what makes sense for them, and what meanings might they be making with the experience that they have is important. And I think psychotherapy definitely does offer that in a way. So
Can you tell us a little bit about, so you said what a typical session looks like is 4 to 5 sessions of dosing, and then integration? Is that
So
like first the clinical evaluation?
Generally 3 preparation sessions, 1 dosing session that lasts about 4 to 6 hours, and then a minimum of 6 integration sessions. As we move into more complex trauma, those integration sessions will span much longer, 6 months, a year, multiple years, a decade, to fully integrate the experience. And for some folks, 1 dosing session, for some it's more of a maintenance thing where they do maybe 1 larger session per year. It's really patient-centered and patient-specific based on the journey.
Right. And the integration sessions are the different modalities, or is it talk therapy? What does the integration session look like?
Yeah, so integration comes in many forms. In terms of the actual 6 sessions, it is talk therapy, maybe paired with some art therapy or somatic embodiment therapy, depending on the client and their needs. But integration can come in many forms. Maybe it's meditating, maybe it's journaling, maybe it's getting into nature, maybe it's connecting with your community. It's very patient-centered and takes a patient-centered approach.
This reminds me of, I had attended a conference and they had mentioned that mindfulness and the breath, when we are in a state of like a prolonged meditation, right? And how our breath is sort of going through these stages, the effect that it has on the brain is similar to what psychedelics do. But mindfulness is a longer, like it takes more time and it requires it's years of practice, and then you reach that, whereas with psychedelics you have an immediate access to that, right? Is there do you have knowledge around how the breath works with the experience of psychedelics, or while integrating psychedelic experiences?
For breath work? Yeah, breath work is very powerful and can also result in you entering another altered state of consciousness. So breath work can be a very powerful tool to prepare for a psychedelic experience or integrate a psychedelic experience. In our training program, one of the days is dedicated to breath work, where one participant will have an experience breathing. They'll begin, they'll prepare for that experience with their partner. And then after, they will integrate the experience, and then they switch roles, where one partner will be holding space and one will be having the breathing experience. So it's definitely a powerful tool to enter an altered state of consciousness. So the breath works that we use in training are holotropic breath work by breath, or conscious connected breath work.
I was curious, do you offer training? The center that you're working with offers training for mental health practitioners in psychedelic therapy, is that right?
That's right.
Can you say a little bit about the training itself?
Yeah, for sure. So we have 2 training programs. One's our intensive training program, and one is our prescriber training program. So our intensive training program is 146 hours, and it comes in 6 components. So part 1 is the pre-readings. Part 2 is the 5-day in-person intensive, where you'll cover modules 1 to 10. So this is on our website at TheraPsil.ca/training. And the 5-day experience really prepares you on how to safely and effectively guide a client through a psilocybin experience, while also including different experiential components such as breath work, art therapy, to really, it's just as much about doing your own work, training, because you can really only take your client as far as you're willing to go. So that's the 5-day intensive. They are small group experiences, and we host them across Canada. And we actually hosted our first one in the States, in LA, in November. And they're maxed at 12 people. And that's so you can really have that safe create that safe container that's necessary to do this work. Part 3 is the online learning. So we touch on these topics in the 5-day intensive, but they are so important to doing this therapy that we want our practitioners to do a bit of a deeper dive into these topics, which include Indigenous teachings, music training, neurobiology and neuropharmacology, and ethics training. And then part 4 is the actual experience, where the healthcare professional ingests a full strength dose of psilocybin, and they are supported by their learning partner. Right now, we're not getting legal access to that in Canada. So folks are self-organizing their own experiences and then challenging that model. So they'll have an experience with the psychedelic, and they'll also have an experience holding space. So they'll prepare, they'll dose, and they'll integrate. And then part 5 is supervision. So we want to ensure that both the practitioner and patient are really held in the experience. So when our healthcare professionals begin working with patients, we ask them to do a minimum of 10 hours of supervision. And then finally, the 6th component is community of care and practice. So once again, don't want folks doing this work on their own. So we've trained about 450 healthcare professionals to date in how to safely and effectively guide the client through a psilocybin experience. So we've got a community of care and practice on Mighty Networks, which really hosts all of the supporters, patients, and healthcare professionals, and allows them to connect, consult, and network, and also stay to date with everything that's happening in the psychedelic space and legal landscape, and sign up for additional trainings.
That sounds like a really good structured course. Training.
It's very robust, and then the prescriber course is much more high level. It's a 4-hour program on really the contraindications, neurobiology of psilocybin and experiences, and study research, and also on how to fill out the special access program application that doctors and nurse practitioners are required to fill out to apply for special access in Canada for their patient.
Sounds like it really equips the practitioner to do this sort of therapy. I'm also wondering, is there work that you do with neurodivergent or disabled communities? I know chronic and terminal illness is, of course, included in that. Like you said, you do work with end-of-life cancer patients, but also with neurodivergent or disabled communities. What has the experience been like?
Yeah, absolutely. I can't really share any information about patient experiences, but we do prioritize non-dominant communities in our training program. And so we encourage them to apply and reserve a minimum of 30% of each of our training cohorts for these populations. And we just rolled out a bursary for the next year, to have a bursary for each month of for a training program of $500 per month for these communities.
Is there some sort of scholarship or anything that you offer?
That's what I was just talking about, the bursary.
$500. Yeah. Arti, do you have any questions?
No, I'm just sitting with, just the global south and what we sit with, and how the lack of access to any of this that you're talking about, and I'm just feeling heavy. It's like, just the disparity in access and disparity in what is possible can be slightly frustrating. I think I'm sitting with the fact that we're listening to something that feels many worlds apart and very different dimensions across. This is happening while we're here working with really holding space for mental health spaces in India, and mental health spaces that we work with are for people who live in the margins, and I think learning from and just hearing from you that looking at some of the things, the ways in which drug use does happen, even in the marginalized communities here, and how do we hold space for what is showing up as it is showing up, is important work that I know that we do. And to hear you speak about offering or working with the medical model and the community there to open access for medical gatekeeping actually lands very differently for me, primarily because, again, medical gatekeeping is such a problematic thing here in this country. So so it's just interesting that like there's so many disparities that are present in the ways in which we think about mental health or what is possible. That just sitting with that as I hear you talk.
What sort of, when you work with end of life patients, right? And you said that it helps them separate cancer from themselves. What sort of insight does it offer into life and death, I think? I know this might sound like a heavy question and perhaps a more like person-centered question, like for everybody it might be different. But since you've had experience with grief a little bit, right? And grief makes us sort of face the reality of death, I think, and life. So I wonder if there's any insight you can offer around that.
From my own experience, I would just say that, it perhaps psychedelics have offered me that, my grief is not me. I am separate from my grief, and therefore my thoughts are also not me. And so as an individual, that I can keep moving along because that is just an experience that's happened to me. It's not me. So just creating a little bit more separation in life, I think, is really important from our grief and our trauma and our experiences.
And I think Ivy will agree with me that this is something that we do in psychotherapy also, where we separate the problem from the person, right? And I'm thinking, what does that do, Aarti? Like if you were to give just like an insight into what that does for a person when that happens, when we are able to separate the problem from the person.
I think in the example of grief, I'm thinking about how there is no single story of grief, and there is no single story of what happens to us in our relationship with people. And I think being able to see the dimensions and the landscape of who we are and how we interact with people that we are grieving is the sort of bigger picture that that we'd like to access. Like I would imagine that just again, like you were saying, I think it really depends on who we're sitting with and what the conversation is, but to be able to have language to the relationship that I've had with someone that I am sitting in grief with, or because of circumstances and I think it's important to access the dimensions of my relating with the person and the situation, and that there is more to the story of my relationship, and I get to sort of access the dimensions of that. I think that's what sort of being able to see grief outside of oneself means.
It also allows you to honor what's important for you and also for the loss, person you've lost, right? When you're able to see grief separately. And also, I think with terminal or chronic illnesses, when you're able to sort of feel okay about our illness or like see it separate from us, we are more encouraged to live the life we want to live, I guess, and find more hope in that. And the dominant story doesn't become about the illness, but about everything else that is happening. So we focus a lot on social justice as our stance paused, right? I'm wondering what potential the psychedelic therapy have in the social justice model. If there is anything that you can think of.
What do you mean by that?
While we work with marginalized communities, how do we look at the systematic problems that are there, right? And how do we offer, how do we bring in a sense of justice while we are working with internalized oppression or anything of that sort, any systematic problems, right? I wonder, to me, what social justice might look like in a psychedelic experience is to perhaps come in touch with different parts of myself that I've internalized, and like even the oppressive parts, like that have been there, and then challenging them or whatever, right? Like integrating that experience, perhaps. I don't know.
Yeah, I think when we heal ourselves, we have more capacity to help others and heal others. But everything that's happening in the world right now is just absolutely devastating. So I want to be careful to say that a psychedelic isn't a magic pill or a one, isn't going to fix all the world's problems, because they are so deeply rooted. But I think when we do heal ourselves, we have the capacity to help other people more, and maybe come into confront the pain that we've caused others, perhaps, and ensure that we don't do that in the future. And that could be through integration, perhaps. But I think there's so much healing that has to happen in the world that psychedelics could potentially be a first step. But there's a lot of systemic oppression and systemic changes that need to happen across the globe before.
Yeah. And to me, it sounds like a very, you need to be really committed to the process of going into this therapy, right? Because a lot of challenging things might come up when we do that sort of deep healing.
Exactly.
A lot of trust, safety, and commitment, which is also true for psychotherapy. Yeah, but I think psychedelics offer us a more immediate access to what's happening inside of us. Do you have any closing statements or questions?
No, thank you for being here and doing this. Yeah, I'm so curious about the layers of possibilities when we think about centering ideas of social justice in psychotherapy work itself, and then psychedelics and what they might offer. But yeah, we'll stop for today, and thank you so much. Yes, it was really.
Thank you so much for hosting this conversation. I appreciate your time.
Thank you, Yasmeen.
Okay, bye now.
Bye.
All right. Bye.